Have you ever started CPAP or APAP and felt like I can breathe in but just cannot breathe out comfortably? And this is where something called EPR may help. But here's the catch, in some patients, using a wrong EPR setting can actually make treatment less effective. Many sleep apnea patients are started on APAP 5 to 15 centimeter of water with humidification, and they're told just use it and you'll get used to it. But what if the pressure feels uncomfortable, especially when breathing out? Should EPR be turned on? And yes, if yes, when? EPR can make CPAP much more comfortable, but in the wrong situation, it can lower the pressure too much and allow the airway to collapse again. So in this video, I'll explain exactly what EPR is and what it does and who benefits from it and when it should be used carefully. Hello everyone, I'm Dr. PK. I see sleep patients all the time. I manage most of them except the complicated one. I send them to pulmonologist. In this video, we are going to talk about a very important CPAP, APAP comfort setting called EPR, which stands for Expiratory Pressure Relief, EPR. This is especially important for patients who are set up on APAP, AutoPAP, 5 to 15 centimeter of water with humidification, because many people use that kind of starting setup. But very common question comes up: should EPR be turned on? Who really needs it? And when can it actually create problems instead of helping? So let's break this down in very simple language so you understand and you'll be able to make adjustment, of course, in consultation with your doctor. And this is all educational. I am not your doctor. This is all the whole purpose of educational videos to make you smarter so you can ask the right question from a doctor. EPR means expiratory pressure relief. That simply means that machine reduces the pressure a little bit when you breathe out. So if machine is giving a certain pressure when you breathe in, it can lower that pressure during exhalation to make breathing out feel a little easier and more natural. Think of it like this. Breathing in with PAP pressure is usually easier for most people, but breathing out against pressure can sometimes feel uncomfortable, especially when person is new to CPAP or APAP. EPR is meant to improve comfort during exhalation. So on many PAP machine, EPR can be set to EPR 1, EPR 2, EPR 3. There are only 3 levels. Now, this is only means the machine is lowering exhalation pressure by 1 centimeter of water, 2 centimeter of water pressure, or 3 centimeter water pressure. So higher the EPR setting, easier it may feel to breathe out. Why does EPR help some patient? Here's the big reason. Some patients say the pressure feels too strong. I feel like I'm fighting the machine. I can breathe in, but I have trouble breathing out. I feel air is being pushed at me too hard. I remove the mask because it feels uncomfortable. For those patients, EPR can be a major comfort feature. And comfort matters a lot because the best CPAP setting in the world is useless if the patient cannot tolerate the machine and stops using it. So this is a very important point. A patient does not fail CPAP. Sometimes CPAP fails patient because comfort settings were never optimized. What does EPR actually do to the treatment pressure? So this is the part many patients, even some providers, do not fully understand. EPR improves comfort by lowering pressure during exhalation, but that also means it lowers effective expiratory pressure that is helping keep the airway open. So, and that matters. So because obstructive sleep apnea happens when upper airway collapses during sleep. So pressure has to be high enough to keep that airway splinted open, right? But if EPR lowers the pressure too much, some patient may become more comfortable, but their airway may also become less protected. Means there is a chance of collapsing or closing. So that is the trade-off. You got to find the balance. Comfort improves, but airway support during exhalation may decrease. Now, I'll give you an example with APAP of 5 to 15, which is the most commonly used numbers. So let's say a patient is just started on APAP minimum 5, APAP maximum 15. Humidification is on, ramp is on, EPR is added. Now, suppose the pressure is sitting around 5 to 6 early in the midnight. And if the EPR is set to 3, during exhalation, the pressure can drop about 3, right? This means the effective pressure during breathing out may become quite low. And that can be a problem in some sleep apnea patients. That is why EPR is not just about comfort setting, it's the comfort setting with the treatment consequences. Here's the hidden danger. A patient may say, this feels much better, but their airway may actually be getting less support when they need. Which patients are most likely to benefit from EPR? EPR is usually most helpful in patients who have pressure intolerance. That includes new CPAP patient, new APAP user, anxious patient, patient who feel claustrophobic, patient who say exhaling feels hard, patient who awaken when pressure rises, patient who keep removing their mask because of pressure discomfort, patient who need a little more comfort to improve adherence. It can also help people who are very sensitive to pressure changes and need a machine to feel more natural. So the main reason to use EPR is not body size alone. The main reason is, does this patient need exhalation comfort to tolerate PAP therapy? That is the real question. Does body habitus matter? That's a very smart clinical question. The answer is, body habitus can matter indirectly, but it does not decide EPR by itself. For example, I'll give it to you. A patient with a high BMI, big guy, large neck circumference, more severe airway collapse, and they have REM-related or supine predominant obstructive sleep apnea, may need stronger airway support. So if you give high EPR and keep minimum APAP pressure too low, the airway may not stay open at all. On the other hand, some thinner patients are extremely pressure sensitive and may tolerate PAP much better if EPR is used. So body habitus alone does not determine whether EPR is needed. The best way to think about this is this. Patient more likely to need a caution with the EPR: obese patient, severe OSA, supine OSA, marked snoring, persistent hypopnea, significant flow limitation, and high collapsible airway. And patient more likely to benefit from EPR is a pressure intolerance, anxiety with the PAP, difficulty exhaling, poor adherence because of comfort issues. So EPR is really about balancing comfort and airway control. When it should be used, EPR is reasonable when the patient feels uncomfortable breathing out, struggles to fall asleep because of pressure, patient keeps taking off mask, patient say pressure feels too strong, PAP use is poor because of comfort. And when it can be used cautiously, persistent obstructive sleep apnea, persistent hypopnea, snoring despite therapy, significant flow limitation. So thank you for watching. I will make more videos about pressure settings and its usefulness. I'm Dr. PK from Dr. PK Life.